Want to know how I started out working in the trenches as a medical SLP, running between multiple skilled nursing facilities each day, to owning a few different companies and managing a large team of SLPs and support staff that provide education and support to medical SLPs? Well, I'm happy to share my journey with you, so let's dive in. I'm Theresa Richard. I've been a medical speech pathologist for 15 years. I'm a board-certified specialist in swallowing and swallowing disorders. I'm the founder and CEO of the MedSLP Collective and MedSLP Education. Number 1, I noticed a gap in knowledge from research to clinical practice. As an SLP working in the trenches in skilled nursing for 6 years, I researched so many different topics because I was out working by myself on Dysphagia Island. I didn't have other SLPs or mentors in my facility, so I had to learn to be really self-sufficient in the answers I was seeking. As I learned more and more about our patients' conditions and the research that we had access to help them with, I realized I was missing a lot of information. For a while, I was convinced I was just a really crappy SLP, and I had been dealt a pretty crappy hand. But instead of accepting that, I got into motion. I started reaching out to other SLPs. I found out what they knew and what they didn't know either, and it appeared that a lot of us were feeling the same way. We have researchers in this field who are doing incredible work, but for some reason there was a real disconnect between what our researchers were finding and what we were implementing into clinical practice. According to Bauer 2020, studies show that it takes 17 to 20 years to get research translated into practice, with fewer than 50% of these studies ever making it to clinic. After hearing about this long lag and clearly witnessing it in real time in my career, I knew I had to do what I could not only for myself and my patients, but also for my colleagues that were struggling as well. After having these realizations, I started the Swallow Your Pride podcast to start having public conversations with researchers and clinicians out in the field. This created more awareness of the bigger problem of so many SLPs wanting to do what's best for their patients, but just not feeling like they had access to the research, and not only access to it, but how to interpret it. What does it look like in their day-to-day? And if it doesn't work the way it's supposed to, who can they reach out to swerve the plan of care? All of these questions drove me to creating the MedSLP Collective. I really had no expectations of what it would become other than I wanted a place for myself, my friends, and my colleagues to get some answers they were seeking. I'll be posting other videos just like this one that you won't want to miss, so make sure to hit that like and subscribe button and turn on the notification bell. Do you have any specific questions about starting an SLP business? Leave a comment below and tell me about it. We'll be sure to get your questions answered as soon as possible. Number 2, I knew that many heads were better than one. As I started to reach out to more and more people for the Swallow Your Pride podcast, I was incredibly impressed with the depth of knowledge that so many of our colleagues had. I knew that if we could create something that put so many smart and experienced and passionate and caring people together in one place, that we could do some really amazing things for this field. This is where my transition from the clinical side to the business side of speech-language pathology had its first major spark. There are so many brilliant brains in this field, and I knew that I wanted to be able to find a place to put all of these incredible brains that everyone could learn from. I also knew that I could not and did not want to do this alone. When I had the idea for the MedSLP Collective, I thought I would bring in a few contributors to help write some content and resources and do the webinars for CEUs. I had no idea that the requests for topics ranged so wide that we would need to expand farther out than my circle of friends. So we brought in even more contributors to help write about topics that we really knew nothing about. And then came the quality piece. We were all writing and contributing from our own experiences and our own education. But was it from the latest evidence, or were we biased to our own beliefs? This is where our editorial review committee was formed. I'm eternally grateful for the wonderful people that were so invested in the collective that we created a separate division for editorial review, one that was completely separate from the contributors. As our resources grew and our community grew, we added in mentors that were committed to responding to clinical questions in our forum. Again, I had no idea how amazing this community would be and the incredible dialogue and responses that have taken place. This led us to growing our team of mentors, and it just continues to keep growing. Number 3, I wanted to create something sustainable that would last. There are many, many wonderful communities that are available for SLPs to lean on and network with. But I kept realizing time and time again that they would start out strong and then fizzle out when other priorities crept in and took precedence. The reality is that we all want to do good work and contribute and give back to a profession that's been so rewarding to us. But sometimes that model is not sustainable for long-term growth, as people deserve to be paid for their hard work, time, and expertise. I've had a few free communities for a while that, although they were wonderful for the purpose they served, they had extreme limitations. Ones that did not sit well with me when other professionals were out there seeking answers to their questions. I also wanted to create a platform that would be independent, meaning not rely on other social media networks or platforms, as in we build it and the material lives on it forever. In seeking answers to all these problems, I knew we had to create something different that hadn't been created before. I sought out business mentors and coaches in the healthcare space to help me formulate these ideas. I had no idea my career would take this turn, but I'm grateful that I just kept pressing forward. I've got a free gift for you over at the MedSLPcollective.com. You'll get instant access to our free MedSLP Collective clipboard kit. We also have a robust and vibrant community of SLPs and mentors to help you out with your toughest clinical cases. Head over to MedSLPcollective.com now to get your hands on this. The link will be in the description below.